Well, February is American Heart Month, a time to really think about good heart health, and that is so important as heart disease continues to be the leading cause of death in this country. In this morning's Living Well, we talk a little bit about prevention as well as some important tips when it comes to the warning signs of heart disease.
Every 34 seconds in the United States, someone dies from heart disease. We know that the United States actually spends almost $230 billion a year on this disease.
With statistics like these, it's important to know the risk factors and work to reduce them.
The major risk factors are high blood pressure, high cholesterol, and smoking. But there are many others, including diabetes, obesity, unhealthy diet, physical inactivity, and excessive alcohol use.
Protect your heart by implementing a healthy lifestyle. Eating right, monitoring your cholesterol, and exercising can make a big difference.
Even the smallest changes in our life can make a difference.
Also important, education, knowing the warning signs for heart attack and stroke.
You can have heavy pressure in your chest, pain, burning, fullness, the old adage of an elephant sitting on your chest. But you can also have other symptoms such as tingling, burning, prickling sensations. You can feel this in your arms, one or both. You can feel it in the back of your neck. You can feel it in your jawline, even in your stomach area.
Doctors also say watch out for unusual fatigue, cold sweats, racing heart, and dizziness. Signs of a stroke can be different.
You can have sudden weakness or numbness in your face, arm, or leg. It can happen, especially if it's on one side. Sometimes people will have confusion, trouble speaking, or even understanding. You may lose your vision in one or both of your eyes. You may have trouble walking, coordination issues, balance issues, and you may have a severe headache that you don't understand why.
Dr. Ananthala says it's important to have yearly diagnostic labs and screenings. She also recommends a cardiac CT scan.
And this test basically looks for calcium buildup in your arteries. It's a very simple test. You just lie down on the CT scanner and let it do work. There's no dye, there's no pills or anything of that nature.
And throughout this month, HMG is offering those CT scans for just $49. That is a $20 discount. If you would like to purchase one for yourself or a loved one, just go to holstonmedicalgroup.com. Such an important topic to be talking about. We look at the statistics and we talk about heart disease a lot. So February, that time to remember those warning signs. And
Amy, you actually took this a little bit further. You took the story just a little bit further yesterday. Tell us about that.
Yeah, so yesterday I went in and to the HMG Diagnostic Center, which is right here in Johnson City, to have this test done. I wanted to share the experience with you because, Chris, I think it's so important. Oh, yeah. A lot of people might be intimidated. It's so easy. They hooked me up to that little heart monitor that you see there with those little stickers. You lay down on that bed and it moves you through that machine. And you can see it kind of looks like the big donut.
Yeah.
And tells you when to hold your breath, and you let it out, and you hold your breath again. It takes less than 10 minutes. And a couple things, this test is read by the cardiologist. It's also read by a radiologist. So it looks over your heart, gives you that calcium score to determine any risk, but then that radiologist looks at it to check for any other issues in the chest areas that are captured in the images. So it's really comprehensive.
Now, I got to know, did they give you some results of the test? Did you get a score on that yesterday?
So normally it'll take a couple days to get your results back, but they went ahead and looked at it for me just to give me that preliminary for today.
Right.
I have a 0 calcium score.
Nice.
So that's good news.
Yes.
No calcium was detected, but after you're done, they give you your scores. They let you know what the radiologist said as well as the cardiologist. So they recommend the test, maybe once every 5 years, they were telling me. But it's such a quick and easy test that can really assess your risk factors.
And being able to get that for $49 is so important to a lot of folks that may be underinsured or don't have any insurance. It's a good way to make sure that their health is still in good shape.
And there's no extra bills. So you don't have to worry that something else is going to come in the mail, which I think a lot of people are worried about. It's like, well, the test may be $49, and so through the month of February, you can get that test. You can even give it away as a gift card to somebody else to have them get the test. $49. You can go to holstonmedicalgroup.com to take a look, to purchase your gift card, and then you can use it at any point and make your appointment throughout the year. You can buy it online. And right now, we want to give away 2 of these heart cards. So if you would like to win, you can call the number right here on your screen. It's 423-232-8747. Again, that's our contest line, 232-8747. Leave your name and number, and if you are one of the winners, we will contact you following the show. We give away a lot of things. Now we're giving away a heart card.
Absolutely. One of the most important giveaways we've ever done.
Yes, a test that could save your life.
All right. We'll be back with more Daytime coming up.